Thanks for the introduction, Scott, and thank you very much for inviting me. I think we've had some very exciting and positive examples this morning of what big data can do for public health. And I was very pleased to hear that the bulk of the questions at the end of the session were around, well, that's great, that's all very interesting, but how do we move from an exciting research topic to something that can serve the public health community? And I'm primarily a public health practitioner, so that's the question I'm most interested in, and I hope I'm going to address to some extent in these few minutes. Before I start, I just want to quickly thank two of my colleagues, particularly Dr. Larry Madoff at ProMed and Professor David Harper at Chatham House, for some of the content in those slides. So what I'm going to start with talking about is giving you a broad definition of what public health surveillance is and why is it so important for infectious disease research and infectious disease management. I'm then going to focus on the current surveillance landscape, particularly the balance between what most of the field epidemiologists in the room will be familiar with, traditional surveillance mechanisms that have been in place for a long time, and new emerging methods of investigating disease. And I'm going to try and project myself into the future, looking at some of the challenges beyond the technical challenges. So really, public health surveillance is all about continuously and systematically collecting data to analyze and interpret this data for the planning, implementation, and evaluation of public health practice. What this means is that we use surveillance data for several things in public health. The first one, and the one that was most discussed this morning, is to detect public health events, and to detect them as early as possible, to be able to respond to them as early as possible. The second use of public health surveillance data is to document the impact of an intervention or to track progress towards specified goals, so very much a monitoring and evaluation tool. And finally, surveillance can also be used as a policy-making tool to describe burden of disease, to monitor and describe trends in order to set public health priorities. The reason why we're so concerned about infectious diseases and why we emphasize the use of surveillance is that infectious disease traditionally have had a very big burden on human populations. If we go back to the Middle Ages, in the 14th and 15th century, a plague, which was one of the major public health concerns at the time, killed a third of the European population. And more recently, in the 20th century, we've had successive waves of flu pandemics that have killed in the millions and the tens of millions. However, in the 1960s, there was a wave of optimism because of the advent of antibiotics, because of the widespread use of vaccines, and because of generally improving healthcare conditions. There was this idea that really infectious diseases were going to be a thing of the past. And there's this famous quote from the US Surgeon General that in 1967 it was time to close the chapter on infectious diseases. And really the reality in history has proven him wrong. And particularly in the 21st century, because of the increased volume of travel and trade, what we've seen is, rather than a decrease in infectious diseases, we've seen an increase in emerging infectious disease events. And I'm thinking particularly of things like SARS in the early 2000s, and more recently MERS in 2012, Ebola in 2014, and now Zika in 2016, that have had quite a large human impact, but beyond human impact has also had very large economic impact. If we try and look at the cost to the global economy of some of these outbreaks, they're quite high, really. The H1N1 outbreak in 2009 cost over 50 billion to the global economy. SARS in 2003 cost up to the highest estimates up to $60 billion. So really, by detecting these events earlier, we can mitigate the impact, not only the human impact, but also the economic impact. And if we look at this economic impact at country level, the effects are really devastating. I'm thinking particularly of Ebola and the impact on GDP on the most affected countries. Think Sierra Leone and Guinea have had negative GDP since the outbreak. The way we traditionally detect these events is through a system that has been in place for a long time and relies on healthcare workers and increasingly laboratories notifying cases of disease to the national public health institutes in countries. And this system is in place in most places in the world. Now, this approach has pros and cons. The pros is that it's a formal, structured system that uses validated and quantitative data and is clearly tied to a response mechanism. The drawback to this system is that the lag between the time an event occurs and the time it's acted upon can be quite long, measured in weeks, months, rather than days. Now, the other disadvantages, this morning we talked a little bit about the known knowns and the unknown unknowns. And one of the drawbacks is we can only report the diseases that we know about in case-based surveillance. In the last 20 years or so, quite a large range of actors have harnessed the potential of the internet and of online data to supplement this traditional surveillance landscape. A lot of these will be familiar. A lot of these icons you will have seen this morning. And interestingly, some of the organizations that are represented on the screen here are not at all health organizations. Google, Twitter, mobile phone networks don't collect health data, but however, this data can be used for health purposes. Other organizations have been set which specifically use online data to better public health. And collectively, the use of online technologies to provide data for disease or health event detection is known as digital disease detection. And I know today's theme is big data, but digital disease detection is broader than big data. It includes, but is not restricted to big data. So digital disease detection includes things like analyzing trends in search engine queries to look at departure from baseline. And that's very much, that's processing very large amounts of data to identify a signal. That's probably the closest to the traditional understanding of big data. But there are other tools, things like participatory surveillance, where individuals are asked to volunteer to regularly report their health status online. There is the analysis of social media. There is the tracking and scanning of rumors and press publications. And there are more recent, really innovative use of technology, such as geolocation using mobile phone data or using the dark web. And I'll come back to some of these. When digital disease detection started about 20 years ago, there was a lot of questioning from the public health community about whether we could use this data in any meaningful or useful way, whether the data was valid in any way. And here what we see on this graph is the superposition of CDC data and data extracted from the Google search engine, flu trends, particularly looking at trends in influenza. And what we see between 2009 and 2012 is very close mirroring of these two data sources. So it is by no means easy, but it is possible to produce valid data using big data for public health. One of the main advantages, or one of the main foreseen advantages of digital disease detection is improved timeliness and the ability to detect health events earlier than traditional surveillance systems. And data and evidence supports this quite strongly. Here we see a study that looks at how many days can be gained before official notification using some of these digital disease detection tools. And what we see, so the higher the red bar, the bigger the lag and the bigger the gain. What we see is by combining some of these different tools and these different technologies, there's a synergistic effect, and we can detect outbreaks and other health events several weeks before traditional surveillance. So here there's a very clear public health potential. And to illustrate this, this is a screenshot from Health Map, which is one of these digital disease detection organizations that scans and tracks different health sources online. And you will see an orange dot in West Africa I think it's over Guinea, and this is an alert from the 8th of March, which reports a strange new disease of unknown origin with symptoms resembling Lassa fever. And of course, this is the first notification of the Ebola outbreak, and that notification came about 2 weeks before anything was detected through formal channels. Beyond just detecting events that would be detected by traditional surveillance, there is a potential to look at health and disease in ways that were previously totally impossible using traditional surveillance. This maps population movements across West Africa using mobile phone data. And what happened during the Ebola outbreak in West Africa was that some of the public health agencies tracked numbers that were calling the Ebola hotline to report cases. And they geolocated the mobile phones making those calls and made the assumption that in the areas where a lot of calls were originating from, well, these were probably new areas of transmission, and then they would send a team to investigate. Another innovative use of online technology to investigate problems that we couldn't previously investigate is the use of the dark web to track trends in transactions of illegal substances or prescription drugs used for recreational purposes. That allows us to create a picture of a public health problem that we simply cannot capture using traditional government-owned systems currently. However, regardless of the potential of these technologies, there are technical pitfalls. I previously showed you the CDC and flu trends data up to 2012. I didn't show you 2013. And what happened in 2013 is that flu trends massively overestimated the amplitude of the influenza season. And I think they estimated double the number of cases that actually occurred. And that was widely reported in the public health press, and actually led indirectly to Google flu trends ceasing to make its data publicly available. Another issue that was alluded to this morning is the signal-to-noise ratio. The amount of information that is available online is exponentially increasing. And yes, we can detect the Ebola outbreak 2 weeks before, but for one positive signal, like the one I showed, there are dozens or hundreds of false positive signals that require intense investigation and don't amount to anything. And in the current state of affairs, there is still a need for human moderation to distinguish signal from noise. And in a landscape of ever-expanding information, it's not clear how this is sustainable. Another issue is the issue of how representative the online data is. And this is a result from a study I was personally involved in, which recruited a cohort of individuals in Sweden to regularly report health events. And what we found when we look at who was reporting, we found that those reporting were younger, much more educated, and more likely to be female than the population they're supposed to represent. And that's really an issue when you're trying to investigate health events, particularly in populations which are disadvantaged, poor, and really not representative of those that use the internet on a regular basis. So where we are now with digital disease detection is that there's a whole range of actors that do not sit within the traditional and formal surveillance landscape, that represent academia, private companies, tech. And these organizations produce informal, unstructured information that has the advantage of being very fast and very flexible and able to detect things that we couldn't detect otherwise, but produce potentially inaccurate and biased data. However, my personal feeling, and I think that's reflected, has been reflected this morning, is that the global direction of travel is that the validity, the accuracy, and the utility of the data is constantly improving. And I'm relatively confident that in about a decade, that the type of data we're able to produce will be as reliable as the data that's produced from traditional surveillance sources. What's also becoming clear, and Scott alluded to it, is that digital disease detection is not going to replace traditional leather sole type epidemiology, but it's really a complementary and new tool, so I don't think you need to change the EIS logo just yet. However, if we want to really incorporate digital disease detection into surveillance, there are a few questions and new issues that arise that need addressing beyond the technical issues. The main one, and one of the most important ones as far as I'm concerned, is the information flow and what we call the actionability of data that's generated through these systems. So one of the mottos of field epidemiology is information for action. Now, digital disease detection generates a lot of very valuable public health information, but is not tied to a response mechanism. And until the information, until there is a formal link between making those detections and having a response mechanism, well, the utility of such information is limited. I'm sure a lot of you use Facebook or Twitter or other social media, and a lot of the information that's on these platforms is personal data. Now, you haven't consented to this data being used for public health purposes or for any or made public in any way, but this is what we're doing, and there are legal and ethical issues around the use of such data that really are only beginning to be explored and addressed. The next issue to be addressed is how do we move from these informal sources, how do we move these sources into the formal surveillance landscape? How do we make the data transaction from, say, an academic or a research group into a public health institute for outbreak response? And finally, another issue that needs to be addressed is that we've seen that digital disease detection represents a very broad range, very different technologies really, that produce a very broad range of different types of data, and public health institutes that are mandated to respond to public health threats are not geared to interpret, analyze, and use such data. And we need to think about how we can standardize these different data sources and to transform this data into information that's directly actionable. So I think this is what the future of surveillance will look like, with country-level, government-owned public health surveillance still very much at the center of the system. And that's because the response and the mandate to protect population remains with governments. What we will see, though, is at the bottom, we will see digital disease detection organizations formally entering this landscape and directly feeding into the surveillance system in a much more systematic way than is currently the case. I want to finish by saying a few words about the project that Scott alluded to that we're working on at Chatham House on data sharing. And this is really a project that aims to provide guidance on creating the right environment and achieving good practice when it comes to sharing public health data. This is a project that's funded by the Bill and Melinda Gates Foundation, and Scott is personally involved in this project. We work very closely on it. And really the purpose is that when a need to share data is identified, well, we facilitate that process and we make it as easy as possible. And we very much have digital disease detection in mind with this project. What we hope to do is to launch our final guidance in October 2016, and that will take the form of both an online platform that will provide very context-specific advice to those parties interested in sharing public health surveillance data, as well as a more traditional hard copy guideline document. So I'd like to conclude by saying that I think there is less and less doubt about digital disease detection demonstrating added public health value, and it's very clear that thanks to these technologies, the timeliness of outbreak discovery has improved. However, what has not yet happened is translating this more rapid discovery of events to a more rapid response. And I think the Ebola outbreak has tragically illustrated this. And if we want to really maximize the potential of digital disease detection, we need to resolve these questions of the ethical, the legal, the formality of digital disease detection and the technical questions. Until then, the potential of digital disease detection remains unfulfilled. Thank you.